A special thank you to each of our subscribers who make this channel possible. Here's today's story. In a Congress often criticized for its penchant for misguided policies and excessive spending, the recent bipartisan support for health savings accounts, HSAs, stands out as a beacon of hope in the healthcare landscape. These accounts, which promote individual responsibility and have been shown to reduce healthcare costs, have garnered overwhelming support from voters across the political spectrum. The recent passage of the Big Beautiful Bill has brought with it several expansions to HSAs, marking a significant development in tax policy that is both widely accepted and beneficial for many Americans. Health savings accounts, established in 2003, have become a financial lifeline for nearly 40 million account holders. They are designed to be triple tax advantaged. Contributions are made tax-free, the funds grow tax-free, and withdrawals for qualified medical expenses are also tax-free. This unique structure encourages frugality and price sensitivity in healthcare spending, which is often lacking in traditional health insurance plans. HSAs empower individuals to make their own healthcare decisions, offering a partial solution to the challenges posed by a tax code that discourages saving and penalizes those who seek alternatives to employer-controlled health insurance. However, the landscape of healthcare coverage is shifting dramatically with the new legislation. J.O., a healthcare expert and author, has raised concerns about how the Big Beautiful Bill could reshape access to Medicaid, the Affordable Care Act, ACA, and Medicare Advantage plans, potentially creating new financial burdens for millions of Americans. The bill introduces new work requirements for Medicaid recipients, mandating that they demonstrate at least 80 hours of work per month to maintain their eligibility. This change, along with the unwinding of pandemic-era Medicaid provisions, could leave an estimated 17 million Americans without health insurance. O emphasizes the importance of vigilance for current Medicaid enrollees, advising them to regularly verify their eligibility with their state's health department. The verification process has become increasingly complex, and many individuals may find themselves disenrolled without their knowledge. For those relying on ACA marketplace insurance, the impending expiration of Enhanced Advanced Premium Tax Credits, APTC, at the end of 2025 poses a serious financial threat. Without these subsidies, the average monthly premium could skyrocket, leaving many families struggling to afford health care. The stakes are high, especially for middle-income families who already allocate a significant portion of their annual expenditures to health care. The potential loss of subsidies could lead to a substantial increase in healthcare costs, further straining household budgets. As the ACA marketplace faces increased utilization and declining enrollment, the stability of health insurance plans may be at risk, with insurers potentially passing higher costs on to enrollees. In addition to the changes affecting Medicaid and ACA coverage, current Medicare beneficiaries are also facing uncertainty. O points out that trends in Medicare Advantage plans are concerning, as insurers report elevated medical utilization that could lead to higher costs for enrollees. With the Medicare annual election period approaching, O urges beneficiaries to actively compare plans rather than automatically re-enrolling in their current coverage, as benefits may be reduced or out-of-pocket costs may increase. For individuals recently laid off, the decision between continuing coverage through COBRA or opting for an ACA marketplace plan has become increasingly complex. While COBRA offers continuity of care, it comes at a steep price, with former employees responsible for the full premium. On the other hand, ACA plans may initially appear more affordable, but the potential loss of subsidies raises questions about long-term affordability. Navigating the intricacies of these options can be daunting, placing the onus on individuals rather than HR departments to make informed decisions. As the healthcare landscape continues to evolve, the importance of HSAs remains clear. They provide a valuable tool for individuals seeking to manage their healthcare expenses while promoting a culture of saving and personal responsibility. However, as new legislation unfolds, Americans must stay informed about their healthcare options and the implications of these changes on their financial well-being. The coming months will be critical for many as they navigate the complexities of healthcare coverage and seek to secure their health and financial futures amidst a shifting policy environment. That's all for this story. We upload videos every day covering many different subjects, so hit that subscribe button to stay informed. Thanks for watching.